Well, that was an important press conference on the stimulus package announced by the government. Moving on now to news from Tamil Nadu. One of the country's oldest institutes of mental health in Chennai has come under a cloud. An NGO that tied up with it 4 years ago has accused the IMH staff of treating inmates like prisoners and denying them the most basic facilities. The institute's director says the charges are exaggerated. Chennai's 215-year-old government mental health institute, India's second largest. An NGO that's been working with it says inmates here are denied basic facilities. It claims there are just 15 blankets and 8 functional taps for 277 people in Ward 6. That there are very few toilets, they are cleaned once a month, and that there are no mugs, so plates are used instead.
The last meal being served at 4:30 and no food till the next day. So what happens to people who are diabetic? There's one toilet for 80 people.
Half the posts in the institute are said to be vacant. Warders are accused of extorting money from relatives of inmates. The NGO says the mandatory post-90-day review for discharge is not done. This former resident says inmates are beaten when they try to escape.
दोनों बाजू को मुरेर दिया जाता है और पूरे चेहरे को कपड़े से बंद करके एकदम पैक कर दिया जाता है और पीठ में लकड़ी से मारती हैं.
Every patient is being reviewed periodically because the Banyan had been working for the past 4 years and they had never uttered anything all these years. If there had been one toilet for 80 patients, the National Human Rights Commission, Mishra IAS retired, who had come as a special rapporteur, he would have closed the Institute of Mental Health.
The NGO, along with disability groups, has planned a fast in Chennai to highlight its findings. In Chennai, Sanjay Pinto, NDTV. We're now joined live by Vandana, who in fact runs an NGO and made these allegations in the first place. Vandana, you heard the IMH director, Dr. Satyanathan, saying that the NHRC had visited the campus only in July and had given the institute a clean chit.
Yeah, I didn't hear it, but now I've heard it from you, Sanjay.
Yeah, he says that the NHRC has given the IMH a clean chit. So what are your allegations about, Vandana? Also, he said that they have made certain changes. Meal timings have been shifted to 7 o'clock as opposed to 4:30 in the evening earlier.
Right. Yeah, well, I don't know about the NHRC, but these are instances that I myself have encountered and brought up with both the director and the government several times. Once when we were walking to the ward, we saw a woman in the nude, tied, and she was sitting in her own stool. Now, this is something that I saw myself along with another senior doctor and brought it up to the director. Another time, there were 90 people cooped in a building with open tiles and with water leaking in. It was the rainy season and the ground was moist. There were just 20 blankets there. And there was somebody who was really, really ill who was brought up 100 rupees. We will sort of ill-treat the resident who's inside now. Now, all of this, we have witnesses for all of this. And I don't think, I really don't know what the NHRC has done. I'm not saying that the IMH doesn't do good work. It is a large organization. There's beautiful space there. The director does try all that he can. But this time, all the 3 complaints that we brought up, the director's only response was that my hands are tied. At which point, we went to the health secretary and we said, look, these are gross human rights violation. Especially when we heard from Renu, one of our residents, that she attempted to run away and she was sort of gagged and beaten on the head. So the director then said that he would change the basics of meal timings, which for the past 35 or 40 years have been going on at 4:30 in the evening, which I think is ridiculous because the next meal is served only at 8 in the morning. So we're not an organization that's into slogan shouting or into government bashing. We're happy to work proactively with the government. But if these are the absolute human rights atrocities where you have women in the nude, not having facilities to bathe, just 2 gowns, people being knocked on the head with lathis, intimidation. We ourselves were get out a few days ago. So if all of this is the way in which an institute that is supposed to provide health, that is the response to a mental health issue reacts, then I really don't know what you classify as human rights.
Right, thank you very much, Vandana, for joining us. I'm afraid we are running out of time, but of course, the IMH director denying all these charges. Time now to slide into a short break. Stay tuned, we'll be back.